If you're a lifter between the ages of 30 and 50 and you've been told to rest, if you have pain in the gym but you want to keep pushing, this video is going to be for you. I'm going to share all the secret sauce, so make sure you stick around to the end because I don't want you to miss a stinking thing. All right. So, why smart lifters never just rest through pain? And we're going to be diving into the three-phase system that fixes a real problem and helps make you stronger than ever. If you're a lifter over 30, dealing with pain in the gym, if it's interfering with your ability to push in the gym, you've probably been told one of these lies. Just take time off and it'll heal. It's just time to stop lifting heavy. You're not getting any younger. Pain is just part of getting older. Now, if none of that resonates with you, if you aren't looking to hit pain-free PRs, if you truly just don't believe that there's a solution to your pain, I'm going to tell you, just go ahead, click off this video because I absolutely want to be respectful of your time. And this is only for lifters who are having pain in the gym or it's interfering with their progress in the gym. And they do believe that there is a solution, because belief is very important for you to actually get out of pain. If you're still here, I would assume that you're a lifter who's dealing with pain, you want to lift pain-free, and you're ready to find a solution that works for you. I'm about to show you why every one of these statements is just absolute BS and what actually works. So I want you to take a second. I want you to imagine a future where you can ditch that pain for good. No more of this, oh, it feels good. It feels good for a few weeks and then it kind of comes back. Or, yeah, I've been dealing with this shoulder pain on and off for 10 years, right? If you are saying one of those things, it is time to find a better solution, one that actually prevents the pain from coming back, because there is something that people have missed up to this point. Okay, we're going to dive into that. I promise we're going to give you all the secret sauce. But I want you to go back to imagining that future where you can push yourself in workouts, where you can play with your kids without worrying if your back is going to seize up getting off the floor. If you want to go out and try this new adventure, you want to try this new thing without having pain, right? If you want to go for a freaking PR, if you want to compete, I don't care what it is. If you want to hit pain-free lifting, if you want to have a pain-free lifestyle as a lifter, this is for you. I want you to also imagine a future where you don't need expensive imaging. You don't need to take time off the gym. You don't have to lose your gains. You don't have to give up the thing that makes you you. You don't have to chase your tail trying to find the next best solution or buy all these little gadgets that your buddy has used because, oh my gosh, this worked for my pain, so it's going to work for yours. And then it doesn't. So I want you to imagine a future where you just don't even have to deal with that. You just find something that actually gets to the issue and you're able to lift the way you want to. So this isn't theory. This isn't false hope. This is what happens when you stop treating the symptoms and start fixing the real problem. So either I'm the luckiest coach on the planet or something fundamentally different about the way I approach pain for lifters. So I'll introduce you to my guy, Tyler. Tyler is just like you. He spent years in PT trying to find a solution. As he got closer to 30, the doctor said, well, you're just getting older. Maybe you should stop pushing so hard in the gym. Tyler got told that because of his pain, he should give up the weights. He should try something a little bit lighter. Fast forward, we are crushing weights and he's stronger than he's ever been. And he's more confident in his body than he has been in a very long time. Tyler came to me and he said, hey, you know what? I'm so tired of being this version of myself, of having pain, wondering when it's going to flare up again. I used to be the guy that would help everybody move. I could be the guy that no matter what you asked me to do, I could do it. He said, I went from that to literally having to ask my wife to carry the laundry basket upstairs because it hurt my shoulder too much. And he's like, I'm a man. I should be able to do that. But he had to rely on his wife to do something basic just because his shoulder hurt and because he was in the run-of-the-mill PT, out of pain, back to pain, out of pain, back to pain. Anytime he pushed, he started having pain. Next, I want to introduce you to my guy, Merlin. Merlin is a world's level powerlifter, and he could not raise his arm above his head. So I met Merlin a few months before all this happened. He was prepping for a meet. He went, crushed the meet. A few weeks later, he literally couldn't raise his arm up over his head. So he was having trouble with his confidence in his bench. He literally couldn't even take the lat pull down for his accessories and like hook it onto the machine because he just couldn't raise his arm up over his head. We got to working, and literally within just a couple short months, we went from I can't raise my arm to this is actually old. He messaged me yesterday and he hit a 315-pound bench in the middle of his stinking rehab. It's crazy. So if you're still here, I want you to know this video is for you if you're losing progress in the gym because of pain. If it's waking you up in the middle of the night because maybe you rolled over and now it hurts, it's waking you up. You have to maneuver in the bed. You're not able to push the way you want to in the gym. You feel like you're losing confidence, right? If you're tired of endlessly searching YouTube, Google, ChatGPT, Instagram for a solution that honestly you just feel like you're losing hope in because you've tried 10 different videos, all the save these 3 exercise videos, you've tried those and it's not getting any better. This video is for you. If you're tired of doctors saying just stop lifting, it'll be okay, you don't need to push that hard anymore. Or if you're tired of bullshit band-aid approaches that honestly just keeps you stuck in that hamster wheel. Or if you're tired of those little exercises that just don't translate to the gym. Or the roller coaster of emotions, right? Kind of going back to my guy Tyler. He had no pain. Then he had pain. No pain. Then pain. Just on and off. On and off. And anytime he would push in the gym, pain came back. So it wasn't actually fixing anything. After working with over 500 lifters, I want you to know that your pain isn't telling you to stop. It's telling you that something in your system needs fixed. Okay? That does not mean more cortisone shots. That does not mean any of those latest and greatest tools. So after working with 500 plus lifters, I want you to know that when you fix the right thing, you're not masking the symptoms. You're not just trying to be scrappy and maintain the progress that you've already made. You actually get stronger than you've ever been because the system is working for you and you're actually feeling good. You're feeling confident. The pain's not there and you're able to push the way you want to. So if you're tired of choosing between lifting and feeling good, if you're tired of temporary fixes like Tyler was on that never-ending hamster wheel, and if you want to know how to turn your pain into a roadmap for getting stronger, you need to know 3 things. The first one is a lie about lifting with pain, right? That's keeping 90% of lifters weak and frustrated. And it's not what your doctor told you. So in the next few minutes, I'm going to blow up everything that you think that you know about pain and show you a system that actually works. Second, why every approach that you've tried has failed, why the pain always comes back, and why it was actually designed to fail from the start. And 3, the exact 3-phase system that takes you from I can't lift without pain, I'm losing progress in the gym, I'm frustrated, I'm confused, I've tried everything that my buddy has, to I'm stronger than I've ever been in 90 days. And that is what we get a lot of the times with the lifters inside my program. Now, before I dive in any farther, why listen to me? Who's this chick on the internet? How does she even know? Okay. So I once was you. Oddly enough, I never realized until I was putting this together. This picture actually represents how I felt with injury. I literally felt caged in. I literally felt like I didn't know where to turn. I lost my identity. I was so confused. I was struggling. I lost a bunch of weight because I was just super upset. This whole piece of me after I got injured, it just felt like it was taken away from me. Okay. So I felt broken. I felt weak. I felt hopeless. I felt like my body was failing me. So I'm Dr. Kaytlyn, and I've spent the last decade and some change doing something that most physical therapists won't do. And that's actually getting lifters back to peak performance, not just, that's good enough. Or telling lifters, hey, you know what? You don't need to push that hard. I'm absolutely calling bullshit on that play because if you told me not to lift heavy, I'm probably going to give you the middle finger, right? I am a straight shooter through and through, a little too honest sometimes. And honestly, if someone were to tell me, hey, you shouldn't lift anymore, you're just getting older, probably not the best thing for someone to say to me. So I always enjoyed lifting, right? I worked out with a boys basketball team. I worked out on my own. I was just trying to become that best version of myself to go play college softball. So I got signed. I was getting ready to go play college softball. In my senior year of high school, I got smoked in the knee and it literally ended my career. So wasn't going to the pros. I wasn't doing anything like that. But softball and basketball were like who I was. Like I was the athlete, right? I was that kid that would just push hard, and I was relentless at trying to have like my best performance. So fast forward, I ended up having surgery. Pain was just unreal. I felt like my mom could look at my knee and it would literally just send me into a frenzy because my knee hurt so bad. I was wearing my knee brace up and down stairs. I had to wear special shoes when it rained because I was scared that I was going to slip and undo everything, right? I got weak. I was scared. I was frustrated. I didn't know what to do. And, for me, I remember I was sitting in the outpatient room, right? And I was doing my therapy, and I was like, why the fuck am I doing the same exercises that this 80-year-old who just had a total knee replacement? Why am I doing the same exercises as them? I'm like, how is this going to make me an athlete again? How is this going to get me back to the field? Thankfully, I ended up having a pretty decent therapist after that who took me to the softball field and really changed my mind and my view on what therapy could be. But it didn't help me not feel broken. It didn't help me not feel weak or hopeless. Looking back, it changed everything with how I treat. But in that moment, my identity as an athlete just felt like it was gone forever. So I was lost on how to get my life back. I wasn't sure what to do. And, suddenly I felt like the catalyst for everything in my life was just like coming to a screeching halt. I was going to have to tell my dad, like, hey, I just don't feel like I can play ball anymore. Like, my knee just doesn't, like, it hurts. I'm scared to death of having to go through this 12-month rehab again. But I was struggling because I was like, who am I without sports? Right? So what happened next was literally beyond my wildest imagination, and all these things that were deemed bad by the surgeon, by physical therapists, whoever. All these things that were bad were actually what gave me my life back. I decided I'm going to just do this thing my own way, right? So I found lifting, and I powerlifted. I did Olympic weightlifting. I qualified for nationals on 2 ACL surgeries because I actually ended up having to get a second one, not because of lifting. So I decided I was just going to make my own program. I was going to go against the grain, which is very characteristic for me. I was like, I'm going to show them. And not only was I living without pain, but I was able to squat, lift, run without pain. I never thought, this 19-year-old kid, I never thought that this version of me would ever exist again. So 11 years later, I'm using the same system that I used to help me get back on track. And I've coached over 500 lifters overcome pain while staying in the gym and stronger than ever. Because I do truly believe that strength can be life-saving and can be life-giving. I do believe that being strong is literally the antidote to having pain, to having all of these issues. Being strong is like, it truly changed my life. And so for me, when people say, if it hurts, just don't do it. No, we're going to figure out a way to help you stay in the gym, keep pushing weights, keep getting stronger, keep getting bigger, whatever your goal is. We're going to help you with this system. I worked with multiple providers who didn't get it, whether I was the patient or whether they were my colleague. Why are you lifting? Isn't that dangerous for you? No. Being fat, being lazy, being weak, that's dangerous for you, right? So if you're like me, lifting isn't just a hobby. It's literally who you are. If I go more than a couple days without lifting, I go stir crazy, and I'm not the best version of myself. And maybe you can relate to that. So I'm on a mission to help change the way lifters get help. When I was going through my rehab clinicals, I noticed that people would only get back to about 80%. Lifters, even less. Right? There wasn't a way to help lifters hit those pain-free PRs, right? The whole just rest doesn't work around here. I don't believe that you should deal with painful workouts. And honestly, I think that we should freaking crush your last PR and do so pain-free. So here's the truth that can change everything for you if you listen to it. Your pain isn't a lifting problem. It's a system problem. What do I mean by that? So I want you to imagine that your car is making a weird noise, right? Check engine light comes on, and your mechanic just says, well, it's fine, just turn the radio up louder. And we wouldn't do that. So that's the same thing that people are saying when, hey, if it hurts, just don't do it. Just rest and you'll be okay. We're not actually fixing the root of the issue. Okay. Same is true if, if we're just masking symptoms, if we're just trying to manage symptoms. It's like if a water pipe busted in my house. Now I'm just over there mopping up the water, happy go lucky, masking the symptom, right? But unless I fix the root of that problem, I'm going to keep mopping up water, right? So unless you fix the root of your issue, you're going to keep having pain in the gym. So you want to get to the root cause if you want to hit pain-free PRs. That's literally the only way to get out of pain and stay out of pain, to keep pushing the way that you want to in the gym. Here's why everything you've tried has failed. You're just resting, thinking it'll get better. But rest doesn't actually fix the movement dysfunction. It doesn't do anything. It just delays the inevitable. You rest, you go back to the gym, you do the same movement pattern, you do the same type of thing, and you get hurt again, or the pain comes back. So then you start resting again because that fixed it the first time, right? It didn't. Lie number 2. The MRI will tell us what's wrong. MRIs show you pictures, not problems. I want you to look at this stat down here. 40% of people with zero pain have abnormal MRIs. I have zero pain. I was rough on my body. I probably have a rotator cuff tear, a disc herniation, you name it, right? 60% of people with pain have normal MRIs. So unless you're getting an assessment done, a whole body assessment, you're missing the problem. You're missing what's causing the pain, right? Line number 3. Do these 3 exercises and you'll be fine. You see these Instagram posts everywhere. You see these YouTube videos everywhere. Why? Because that is sexy and sexy sells. However, generic rehab without figuring out your root cause is literally like giving everyone the same pair of glasses and calling it good and assuming it's going to work. But the glasses I need versus the glasses you need versus the glasses for the guy who squats 2 racks down from you, all different. Your pain pattern is as unique as your fingerprint. Okay. And so you have to figure out something that is specific to you. So over the next few minutes, I'm going to show you my exact 3-step process that's helped over 500 lifters get pain-free PRs. So this is without imaging, without shots, without basic bullshit that your grandma is doing. This is the P3 method. This is a method that I've used countless times, over 500 times, with my lifters, again, to hit pain-free PRs. So the first thing, we don't guess. We don't assume. We test. We use movement assessments. We look at your movements in the gym, squat, bench, dead, clean and jerk, snatch, whatever it is. We want to figure out exactly what's causing your pain so that we can get to the root of your issue. Because similar to just turning the radio dial up on your car when your engine's messed up, if we don't get to the root cause, it is not going to work. So I want to introduce you to Lauren. Lauren is a CrossFitter and Olympic weightlifter who came to me. She was having some pain. She tried the PT thing. She was trying all these things. Couldn't figure it out. I'm not even joking. Within 2 days, no pain. What? We got to the root of her issue, and despite her going to rehab for 4 or 5 months without any improvement, we were able to get that pain gone in literally 2 days. What? I'm not even making that up. So we found that Lauren was having symptoms, but that's not where the problem was coming from. So we zoomed out so that we could zoom in on the actual problem. So she was having some forearm pain, but it's actually coming from something in her shoulder. We fixed that up within a couple days, no pain. She ended up going on to hit multiple PRs in her training program. Phase 2, the pain eliminator matrix. So this is something that we look for to immediately implement strategies to get out of pain, to fix the real problem that we found in phase 1. This might be mobility, it might be stability, it might feel like, it might be positions, it might be some tweaks, whatever it is. We want to install this so that you can get back to lifting pain-free. A lot of times my lifters, my clients will actually use the rehab before they're lifting. And that is one way that we help get out of pain and keep pushing in the gym. Okay. So I want to introduce you to my guy, Corey. Corey is a strength and conditioning coach. He's a very smart man. He is very well educated. He was having some shoulder pain. This is actually one of his PR attempts right here. He was having shoulder pain, couldn't figure out what it was. So we installed this pain eliminator matrix. We found what worked for him based on pinpointing the root cause assessment. And from there, he was absolutely crushing it. He went on to hit multiple PRs and is still feeling good, no problems. Phase 3. Now, this is where the magic happens. We want to systematically rebuild your movement patterns from the ground up. And truthfully, like, I'm the first to admit, I keep people a little bit longer than what your average PT would, because this step is very important. Phase 1 and phase 3 are the secret sauce, the unique angle that we use to help lifters go from pain, feeling broken, feeling like their confidence is gone, to literally hitting pain-free PRs. So I want to introduce you to Sean. He came to me with some back pain, and we did phase 1, phase 2, and we got strong. Again, he is someone who is hitting many, many PRs. We've worked together for over a year at this point because we wanted to continue to train in a smart and intelligent way. The rehab ended within a couple months, but we have just systematically built out his program to help him continue to lift the way he wants. He's went on to hit multiple squat PRs, multiple deadlift PRs, and those were the movements that he wasn't actually even able to do before we got started because the pain was so bad. So here is the overall P3 method, right? We want to pinpoint the root cause. We want to identify exactly what's causing your pain and build out a personalized pain elimination roadmap, right? Which leads us into this matrix. We want to extinguish the pain. We want to stabilize and mobilize. And then we want to perform, right? Phase 3. We want to return to PRs with peak performance and resilience. Most of my clients on average reduce their pain by 90+%, which is insane because some of these people have failed 6, 7, 10 different people. They've had pain for 5+ years, right? Some people have had excruciating pain for a couple months. Wherever they're coming in at, we are really good at getting the pain gone and hitting PRs in the process. So you have two options, right? You watch this whole thing. We're coming to the end. If you're still in pain in the gym, or if the pain keeps coming back, you have two options. You can do this alone like me, spend tons of time, spend tons of money trying to learn, trying to research, trying to figure out exactly what's going on. Or you can skip those steps and work with me directly one-on-one to collapse the time so that you can start nailing pain-free PRs in literally 90 days or less. Okay. So I'm not going to lie and say, sign up with me today and tomorrow you're out of pain. That's not how it works. There is work involved. However, we can greatly collapse that time down so that you can hit your very own pain-free PRs, right? Just like Lauren, just like Merlin, just like Tyler, just like Corey, just like Sean, and countless others. So I want you to book a call with me if what I've said in this has resonated with you. If you're looking for a system that's actually going to help you get back to lifting the way you want to and just not put band-aids on things, okay? If you're someone who is serious about lifting pain-free and getting stronger and hitting pain-free PRs in the process, I want you to book this 45-minute call with me. This is going to allow us to dive into what's going on, get a good idea of how exactly we can help. We want to talk about your goals. We want to figure out what do we need to do to get from point A to point B. So then we're going to build out a high-level 3 to 5 step strategy that's going to help you get from point A, which is maybe pain, frustrated, confused, losing confidence, feeling like shit because if you're like Tyler, your wife's having to carry up your laundry basket, to crushing it, to hitting PRs, to feeling confident, to reclaiming all of your strength, to hitting those PRs. I want to help you collapse that time gap so that you don't have to keep dealing with this, so that you don't have to have this pain come back in 3 to 6 months. I want you to book your 45-minute call. We're going to dive into all of the things. Worst case scenario, we hop on. It's not a good fit. Maybe you're not a good fit for me. I'm not a good fit for you. Worst case scenario, I refer you to someone else who I think might be a better fit and help you hit those goals. Best case scenario, we decide to work together and greatly collapse the time that it takes for you to go from pain and frustrated and confused, feeling lonely, losing confidence, losing strength, to literally hitting pain-free PRs. I want to help cut through the noise so that you can hit your goals. So book that 45-minute call with me. Link will be down below. Reach out with any questions, and I'm super excited to dig in with you.